You may not have heard of hydroxyapatite, but of course you know coral, which happens to be the source of hydroxyapatite. Amazingly, coral, which is the bone of a sea creature, is almost identical to human bone. I expect that the use of coral as a bone substitute will become one of the most profound advances in cosmetic surgery in this decade. So let me explain why. We all know that people with good facial structure look attractive and they age better than other people. Just think of Claudia Schiffer, Angelina Jolie, Miranda Kerr, and classically Sophia Loren for her wonderful cheeks. Most of us, though, aren't fortunate enough to be born with such good bone structure. But what is astounding and timely is that it's recently become appreciated that, contrary to common belief, the facial skeleton actually shrinks as we age, and by as much as 10%. This is one reason why people seem to lose facial definition as they age. The loss of facial bone is inevitable, despite the best prevention of good exercise and a healthy diet. Those born with good bones do best, because they started off with better definition. For the rest of us, the bone shrinkage adds significantly to the appearance of aging, and unfortunately it occurs at an earlier age. If the changes of the facial skeleton are not addressed, there's a greater need for pulling and tightening the soft tissue. That's why facial bone enhancement, building up small areas of facial bone, is so important. Restoring the bone definition to what it used to be is inherently natural, so the extent of any soft tissue lifting will be less. But why hydroxyapatite? There are other methods of facial enhancement, such as injectable fillers, fat injections, or silicone implants, but these don't have the benefits of hydroxyapatite. Hydroxyapatite is a natural derivative of marine coral, and it's bioidentical to human bone. Coral has been used for many years in surgery, so we know it's safe, it bonds naturally with bone, and compared with other implants has a negligible rate of infection. The hydroxyapatite is essentially permanent, and follow-up studies on patients who have had augmentation of the facial skeleton show that nearly all of the hydroxyapatite remains. What that means is it doesn't need to be repeated. And the third benefit is that its use is quite flexible because it's not preformed like a traditional shaped implant. Because it's made into a putty-like substance, it can be formed to the exact size and shape required by the surgeon. When the hydroxyapatite is used on the mid-cheek, it causes a lift of the soft tissues and reduces the heaviness of bulging lower eyelid bags. The results are highly effective. Its use reduces heaviness around the lower eyelid and also sagging of the mid-cheek. In addition, the skin tones improve, so you look healthier and more vital. Surprisingly, hydroxyapatite is also excellent for younger people whose attractiveness is limited by some area of facial weakness, particularly flatness of the cheeks or a weakness around the jaw. Success with hydroxyapatite requires an experienced surgeon, but one who has a good aesthetic eye. I include it in most of my facial rejuvenation procedures, and in fact wouldn't be satisfied using anything else. If you would like to know more about hydroxyapatite, please contact the surgery for our excellent patient information notes, or alternatively come along and visit us for a chat.